Welcome to today's video about side effects of Mounjaro. Right now, someone is injecting themselves with a medication that's revolutionizing diabetes treatment and weight loss. Mounjaro, approved by the FDA in May 2022, has become one of the fastest-growing prescriptions in America. The results are remarkable: significant weight loss, better blood sugar control, and renewed hope for millions. But behind these impressive benefits lies a story that most patients don't hear until they're already experiencing it. This isn't about fear-mongering. This is about informed decisions. Every medication comes with trade-offs, and Mounjaro, known scientifically as Tirzepatide, is no exception. As a dual GIP and GLP-1 receptor agonist, it works by activating two hormone pathways simultaneously, a groundbreaking approach that sets it apart from other diabetes medications. However, this powerful mechanism also creates a cascade of effects throughout your body. Today, we're examining 11 side effects documented in clinical trials and FDA reports. These aren't hypothetical risks, they're real experiences reported by actual patients. Whether you're considering Mounjaro or currently taking it, understanding these effects could make the difference between successful treatment and unnecessary suffering. Let's explore what the research actually shows. Alright, let's jump straight into the side effects of Mounjaro, beginning with the very first one: gastrointestinal distress. The most common challenge Mounjaro users face affects the digestive system. Clinical trial data reveals nausea occurs in 12 to 22% of patients, making it the predominant side effect. Diarrhea affects 12 to 17%, while vomiting impacts 6 to 9%. These aren't mild inconveniences. Many patients report symptoms significantly disrupt daily lives. The mechanism relates to how Mounjaro works. The medication slows gastric emptying, meaning food remains in your stomach longer. This delayed digestion helps you feel fuller and eat less, but creates considerable discomfort. FDA documentation shows symptoms typically intensify during dose escalation periods. Most gastrointestinal side effects appear strongest during the first weeks of treatment. Research shows symptoms generally decrease as the body adjusts, though some patients experience persistent issues. Intensity varies significantly between individuals, with higher doses producing more pronounced effects. Managing symptoms requires strategic eating patterns, smaller meals, and avoiding high-fat or difficult-to-digest foods. Next, side effect 2: decreased appetite and food aversion. While appetite suppression sounds desirable for weight loss, reality can become problematic. 5 to 11% of patients report decreased appetite so severe that maintaining adequate nutrition becomes difficult. This goes beyond feeling less hungry. Many users develop food aversion, where thinking about eating triggers discomfort. Patients report forgetting to eat entirely because hunger signals disappear. Some go 12 to 16 hours without food. This extreme suppression happens because Mounjaro overrides normal hunger regulation, activating receptors signaling fullness to your brain. Consequences extend beyond missed meals. Inadequate caloric intake can lead to muscle loss, nutritional deficiencies, and metabolic complications. Healthcare providers emphasize eating regularly even without hunger, ensuring sufficient protein and monitoring nutritional status. The psychological impact matters too. Food connects us socially and culturally, and losing interest can lead to social withdrawal. Some patients avoid family dinners and gatherings because food presence makes them uncomfortable. Next, side effect 3: injection site reactions. Approximately 3 to 4% of Mounjaro users experience injection site reactions manifesting as redness, swelling, pain, or itching where medication was injected. For those affected, reactions can become increasingly bothersome with continued use. The body recognizes injected medication as foreign and mounts localized inflammatory response.
Clinical observations reveal some patients develop small, firm lumps persisting for several days. Others experience bruising or burning sensations. FDA data shows patients developing anti-Tirzepatide antibodies have higher reaction rates, about 4.6%, compared to less than 1% without antibodies. Rotating injection sites doesn't always prevent reactions. Some report reactions worsen over time or with higher doses. The abdomen, thigh, and upper arm are approved locations, and switching between areas can minimize cumulative irritation. While most reactions are medically minor and don't require treatment discontinuation, they contribute to treatment burden. For patients anxious about injections, painful reactions create additional psychological barriers. Next, side effect 4, hypoglycemia risk. Low blood sugar represents serious Mounjaro side effects, particularly when combined with certain diabetes medications. Used alone, Mounjaro rarely causes hypoglycemia. However, with insulin or sulfonylureas, the risk increases substantially. Clinical trials show 14 to 19% of patients using Mounjaro with long-acting insulin experience low blood sugar episodes. Danger lies in combined effects of multiple glucose-lowering medications. Mounjaro enhances insulin secretion and slows digestion, while other drugs also reduce blood sugar. Combined, especially during reduced food intake from appetite suppression, blood glucose can drop dangerously. Symptoms include shakiness, sweating, confusion, dizziness, rapid heartbeat, and in severe cases, loss of consciousness. Healthcare guidelines strongly recommend patients using Mounjaro with insulin or sulfonylureas work closely with doctors to adjust doses. Regular blood glucose monitoring becomes essential. Patients must recognize early warnings and respond quickly, consuming 15 grams of fast-acting carbohydrates and rechecking after 15 minutes.
Next, side effect 5, acute gallbladder disease. Gallbladder problems emerge as concerning Mounjaro side effects. Clinical trials document 0.6% of Mounjaro-treated patients develop acute gallbladder disease, including gallstones and inflammation, compared to 0% in placebo groups. While this percentage seems low, gallbladder disease can require emergency intervention and surgery. The connection relates to rapid weight loss. When losing weight quickly, your liver secretes extra cholesterol into bile. Simultaneously, reduced food intake means your gallbladder doesn't empty frequently. This combination creates ideal conditions for cholesterol crystals forming into gallstones. Risk peaks during the first 6 months when weight loss is most dramatic. Symptoms include severe abdominal pain, particularly upper right area, nausea, vomiting, and fever with inflammation. Some cases progress to rupture or infection, requiring emergency surgery. Many patients don't immediately connect abdominal pain to Mounjaro use, delaying diagnosis. Healthcare guidelines recommend anyone experiencing persistent abdominal pain, especially after fatty foods, should seek immediate evaluation. Next, side effect 6, acute kidney injury. Kidney function changes represent serious Mounjaro concerns. The medication's gastrointestinal effects can lead to dehydration, causing acute kidney injury. When severe vomiting, diarrhea, or reduced fluid intake occurs, blood volume decreases, reducing pressure needed to filter blood through kidneys. FDA warnings specifically highlight gastrointestinal reactions may lead to dehydration severe enough to cause acute kidney injury. Patients with pre-existing kidney disease face particular vulnerability. Clinical data indicates monitoring kidney function becomes crucial when initiating or escalating doses, especially in patients experiencing severe gastrointestinal symptoms. The dehydration-kidney connection is critical. When experiencing nausea, vomiting, or diarrhea, maintaining adequate hydration becomes challenging but essential. Healthcare providers recommend drinking fluids consistently throughout the day.
Small, frequent sips work better than large amounts. Warning signs include decreased urination, dark urine, leg swelling, and extreme fatigue, warranting immediate medical attention. Regular kidney function tests help detect problems early. Proper hydration is crucial for safe Mounjaro use.
Next, side effect 7, vision changes and diabetic retinopathy. Vision problems associated with Mounjaro require serious attention. While the medication doesn't directly cause eye disease, rapid blood sugar improvements can paradoxically worsen pre-existing diabetic retinopathy. This phenomenon, called early worsening, occurs when blood glucose drops quickly from chronically elevated levels, forcing retinal blood vessels to adapt rapidly. Patients with existing diabetic retinopathy may experience temporary vision deterioration when starting Mounjaro. The retina's delicate blood vessels, already damaged by prolonged high blood sugar, can become further compromised during rapid glucose normalization. Some patients report temporary vision changes, including difficulty focusing and fluctuating clarity. FDA prescribing information warns Mounjaro hasn't been studied in patients with severe diabetic retinopathy. Medical guidelines emphasize all patients should undergo comprehensive eye examinations before starting treatment and maintain regular monitoring, especially during the first year. Any sudden vision changes, persistent blurring, or new floaters should prompt immediate medical attention. Next, side effect 8, acute pancreatitis. Pancreatitis represents one of the most serious potential Mounjaro side effects. This sudden pancreatic inflammation has been reported in clinical trials and carries FDA warnings. The pancreas produces insulin and digestive enzymes, and when inflamed, results can be severe and life-threatening. Symptoms include severe persistent abdominal pain, typically upper abdomen radiating to back, with nausea, vomiting, fever, and rapid pulse. These require immediate medical attention. FDA prescribing information instructs patients to discontinue Mounjaro immediately if pancreatitis is suspected and seek emergency care. Risk appears highest in patients with pancreatitis history, gallstones, or high triglycerides. Most cases require hospitalization for IV fluids, pain management, and monitoring. Severe cases can lead to pancreatic necrosis, systemic infection, organ failure, and death. Medical guidelines clearly state anyone with previous pancreatitis should not use Mounjaro. Current users must understand pancreatitis is a medical emergency. Early recognition and treatment significantly improve outcomes.
Next, side effect 9, hypersensitivity reactions. Allergic reactions to Mounjaro range from mild to severe. Clinical trials documented hypersensitivity reactions, including urticaria and eczema, with some cases severe. More concerning, anaphylaxis and angioedema have been reported with GLP-1 receptor agonists as a class, though these represent rarest reactions. Signs include skin rashes, itching, hives, face or throat swelling, difficulty breathing, and rapid heartbeat. Severe reactions require immediate emergency care. FDA guidelines instruct healthcare providers to discontinue Mounjaro if hypersensitivity occurs, treat promptly, and monitor until symptoms resolve. Patients with previous serious hypersensitivity to Tirzepatide or medication components should not use Mounjaro. Those who experienced angioedema or anaphylaxis with other GLP-1 receptor agonists should exercise caution. Clinical data shows patients developing anti-Tirzepatide antibodies experience higher hypersensitivity rates, approximately 4% compared to 3% without antibodies. Anyone experiencing allergic reaction symptoms should stop Mounjaro and contact healthcare providers immediately. Next, side effect 9, increased heart rate. Cardiovascular effects of Mounjaro include increased heart rate in some patients. While FDA prescribing information doesn't prominently feature tachycardia, monitoring cardiovascular changes remains important, particularly in patients with pre-existing heart conditions. The mechanism relates to how GIP and GLP-1 receptor activation affects the autonomic nervous system, controlling heart rate. Additionally, significant weight loss creates metabolic changes influencing cardiovascular function. Some patients report palpitations or sensations of heart racing, which can be distressing even when medically benign. For most people, modest heart rate increases don't cause noticeable symptoms or health problems. However, concern arises for individuals with existing heart conditions, arrhythmias, or hypertension. Increased heart rate puts additional cardiovascular strain and may exacerbate certain cardiac conditions. Healthcare providers typically monitor heart rate during treatment, particularly in patients with cardiovascular risk factors. Patients experiencing chest pain, severe palpitations, shortness of breath, or dizziness should seek immediate medical evaluation.
Next, side effect 11, thyroid C-cell tumors. Warning: the most serious warning associated with Mounjaro appears in a black box, the FDA's highest cautionary label. Tirzepatide causes thyroid C-cell tumors in rats, and while human cases remain extremely rare, potential severity demands informed decision-making. In animal studies, rats and mice exposed to tirzepatide developed thyroid C-cell tumors, including malignant carcinomas. FDA requires all patients receive information about this risk before starting Mounjaro. The medication is contraindicated for patients with personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. Animal findings don't always translate to humans. Research shows human thyroid tissue has lower GLP-1 receptor expression compared to rodent tissue, potentially making humans less susceptible. However, caution remains appropriate given thyroid cancer severity. Patients should watch for symptoms including neck lump, persistent hoarseness, difficulty swallowing, or shortness of breath. While these symptoms are nonspecific, they warrant medical evaluation. Ongoing surveillance continues monitoring for increased thyroid cancer rates. Understanding these 11 side effects transforms how we approach Mounjaro treatment. From common gastrointestinal disturbances affecting up to 22% of users, to rare but serious risks of pancreatitis and thyroid tumors, each side effect represents crucial information empowering informed healthcare decisions. The remarkable benefits of Mounjaro for blood sugar control and weight management are well documented. For many patients, benefits clearly outweigh side effects. However, decisions to start or continue medication must involve thorough discussion with healthcare providers about individual risk factors and monitoring strategies. Remember that everyone's experience differs. Some people tolerate Mounjaro excellently with minimal side effects, while others struggle significantly. Your age, overall health, other medications, and genetic factors influence how your body responds. If this video provided valuable information, please type "helpful" in the comments. Don't forget to like, share, and subscribe for more research-backed health discussions. Thank you for watching and for taking charge of your health through education.